About 80 cases from 2020 have been included in Toronto Public Health's case count due to a data review. This means our daily number today is closer to 164 cases, which is the lowest we have seen since early September. And we now have seen fewer than 300 daily new COVID-19 cases for the last 10 days. There are 202 people in hospital, 226 in the intensive care unit, and I'm sorry to report that there have been 9 more deaths from COVID-19. A total of 15,806 tests were processed yesterday with a positivity rate of 0.9%. So overall, the trends continue in the right direction in Ontario. There's every reason to be optimistic, but the Delta variant remains a difficult adversary. It's aggressive and it wants to spread rapidly. We have seen Delta's impact in the regions of Waterloo and Grey Bruce, but I am pleased to say that those communities have done a tremendous job in fighting back. In Waterloo, 80.6% of the population have had their first dose of a COVID-19 vaccine. That makes the first dose vaccination rate among the best in the province, and just over 43% have had their second dose. Grey Bruce is not far behind with 77.6% with one dose and 49.5% with 2 doses of the vaccine. I want to offer my thanks to everyone in those communities for their hard work in managing the recent surge in cases. You are to be commended, and to the people of Waterloo specifically. I know you are making sacrifices by decreasing your social contacts and sadly having to keep some businesses closed, but there is hope. Your sacrifices are helping all of Ontario, and we thank you. For our Ontario vaccination data and rates, just like the residents of Waterloo and Grey Bruce, I would like to thank all Ontarians who have received their COVID-19 vaccine. We've done a tremendous job as a province, and thanks to the public health units, the pharmacists, the physicians, the nurses, primary care, we're doing a great job. Our current 7-day average for daily shots in the arms is close to 205,000 doses a day. And over 15.9 million doses of vaccine have been administered, with over 5.8 million Ontarians fully protected through 2 doses. It's truly remarkable what we've done in such a short time and what we can do as a province when we set our minds to it. I'm proud to live in a province where there's been such considerable uptake and enthusiasm for vaccines and prevention. But I just want to say time is of the essence. As our economy opens up and we once again visit our favorite restaurants, our stores and attractions, as well as visit each other, we must ensure that we are doing so safely, and that means not only to continue washing our hands, covering our coughs, wearing a face covering, staying home when sick, and getting tested if you have symptoms, but also we have to maintain a high level of immunization if we're going to beat this virus. This is a call for arms. Each and every Ontarian that rolls up their sleeve and bears their arm helps make our fight against COVID-19 and the Delta variant that much easier and safer for the fall. Getting immunized not only benefits you as an individual, but it protects your loved ones, your family, your friends, your community, your school, and it protects the health system. Every case in hospital and ICU and every death going forward can be prevented through building community immunity through immunization. It's our collective responsibility to care for each other, to protect each other, and we're calling on everyone who's eligible to get immunized as soon as possibly. Getting immunized also protects those who cannot get immunized or who may be vulnerable to this virus due to being on cancer therapy and or not having a robust immune response. You are protecting them by getting vaccinated. If you haven't considered getting immunized or have any hesitation, please talk to your friends, your family, your neighbors about their experience, since so many of us have been immunized. Talk to your healthcare provider, your nurse, your pharmacist, your physician. They'd be happy to answer questions regarding the safety, the risks, and the benefits of immunization. We need only to look overseas on the impact of the Delta variant. The World Health Organization has warned that Europe risks a new wave due to the Delta variant after Europe saw a 10% rise in COVID infections following a 2-month decline. Israel, a world leader in vaccinations, has seen a jump in COVID-19 infections to its highest daily infection rate in 3 months. In England, as we're all reading, it is the non-immunized population that's being the most impacted, and they're soon going to be seeing an increase in hospitalizations and the use of intensive care units through all modeling. In Australia, nearly half of the population are under stay-at-home orders. This shows how quickly all the hard work that Ontarians have done and the sacrifices we made can be undone by this nasty, aggressive virus. To sustain our progress, we need to see continued improvement in vaccinations through the summer and into the fall. I'm very happy to say that currently 78.4% of adults in Ontario have been vaccinated with 1 dose of a COVID-19 vaccine, and 47.8% with 2 doses. When we factor in all eligible Ontarians, only 67.5% have 1 dose, and 39.6% have 2 doses. 1/3 of eligible Ontarians don't have protection going into the fall. We want, at a minimum, the highest possible level of protection for all Ontarians for a safe and secure reopening. Vaccines are critically important to controlling this pandemic, and it's our ticket out of this pandemic over the next several months. It should be an important reminder of the importance of immunization, that the vast majority of those who have recently become infected with COVID-19 were not fully immunized. And if we look at Ontario data alone, that story is remarkable. So from May 15th to June 12th of 2021, of the 29,380 COVID cases reported, 83.2% had not been vaccinated at all. 15.6% were partially vaccinated, and only 1.2% were fully vaccinated. So I encourage everyone to get vaccinated as soon as possible. And I encourage friends, families, neighbors, and coworkers to help individuals who may have trouble signing up for an appointment or getting to an appointment to help where they can. And the province will continue to work with its partners to also try to reach these patients, clients, and members of our community so we can get across the finish line, start the fall with the highest rate of immunization possible. And for our youth, we are keeping a very close eye on the immunization rate of younger Ontarians. Only 58.6% of those 12 to 17 years of age and 66.5% of those 18 to 29 have had their first dose of the vaccine. Just as a reminder, it's around 9 weeks until the return of school, and for some colleges and universities and on-campus activities. When factoring in the interval required for the 2 doses and time to build immunity from the vaccine, the clock is ticking. We want our young people to be able to enjoy social activities again at schools and colleges and universities. We want them to enjoy their sports, the music, theater, and social events. And for that to occur safely, we need a very high level of immunization. And for those who have already received their first dose, thank you. Please go ahead. You're eligible now to book your second dose within a 28-day time frame. We all want our schools, colleges, universities to return as close as possible to the pre-pandemic normal and as safely as possible. Please, the way to have this happen for all of us is to increase our protection through immunization. So it's a call for arms. Get vaccinated as soon as possible. Time is of the essence and the clock is ticking. Remember, if you develop any symptoms of COVID-19, still get tested and ensure that you enjoy the summer. We need a balance of the mental, physical, and social well-being as we proceed to open up our economy and prepare for a robust and healthy fall. With that, I will open up for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
From John McGrath at TVO. Good afternoon, Doctor. I'm wondering your opening remarks here, are they a result of seeing numbers that haven't been made public? Are you worried about a lack of enthusiasm in terms of vaccinations going forward? We've obviously had a lot of vaccinations in the last 2 or 3 weeks, but are you worried about that dropping off? What prompted these opening remarks from you?
Yeah, the call to arms is just looking at the modeling to date and the percentage of population that's been covered both for elementary school, high school, as well as the university and college age groups. They are the most social, they're the most able to propagate the virus back into the communities, and we watch what's going on in England. That population, that unimmunized population, is the most susceptible to the virus. So the clock is ticking. We only have 8-9 weeks before schools, universities, colleges reopen, and we want those areas of our communities to be able to open as safely as possible. So we've been watching that all numbers on a regular basis. We're making great progress. We're having great coverage of the 60 and over population. They're getting their first and second doses, but the younger populations, we're seeing gaps. And time is of the essence now as our schools are planning to reopen fully in the fall, and hence the reason that I raised this today.
Follow-up?
In terms of the vaccine progress, though, so far, I mean, I think there have been more people, it would be fair to say, who have had a hard time finding an available needle for them than there have been people necessarily sitting out this process. It's going to get easier to get a shot in maybe 2 or 3 weeks' time when the sort of Hunger Games phase of this vaccination is over. Do you think that, are we going to see more people sign up then, do you think, or are you concerned that maybe half of the under 20 crowd may simply sit this out entirely?
We're not absolutely sure, and hence the reason we're trying to broaden the communication, show support for immunization. Our vision is a safer fall, and hence the call to try to book your appointments as soon as possible. The vaccine supply has significantly increased than it has 4 to 6 weeks ago. There are appointments opening up in the systems. If you can't find an appointment locally, there are regional appointments available. So keep trying. Many have been, if they can't find immunization at a mass immunization clinic, they phone their local pharmacist. I very much support everyone trying their best to try to get immunized and keep up those great efforts because we absolutely need the highest rates of protection heading into the fall. Our numbers dropped off over this long weekend. We were just worried that we'll continue to get some drop off over the subsequent weeks and hence have to really maintain the encouragement and the strong support for the best opening in the fall with the highest immunization rates.
Next question.
From Rob Ferguson at the Toronto Star.
Hi, Doctor. Just a quick question on summer camp for kids, overnight summer camp. Have there been any cases reported yet? And if there are cases in a camp, will that be made public, or will that just be quietly reported by the camp to the local medical officer?
To my knowledge, I haven't had any notification of any positive cases within overnight camps in Ontario. That would be reported, obviously, to the local public health agency. If there is an outbreak, so there's active transmission of COVID-19 within a facility, it would be my understanding that that would be made public, but please, I'll verify that. We typically do identify areas where there's active transmission and report that publicly, but I'll confirm.
Follow-up?
Okay, thank you very much for that, Doctor. And just wondering, what is the biggest change in camps this summer? And obviously they're open, so there's 22 pages of protocols. But do you have any concerns going forward with what you've already said about the Delta variant today?
Yeah, they are any congregate setting of children, adolescents who are naturally very social is an at-risk setting, but the protocols are very robust. There is a 2-week protection phase before going to camp, a testing phase. We have protocols that we've worked with the Ontario Camping Association and those respective local public health agencies for a very robust early detection and outbreak response if and when required. There's active cohorting, good infection prevention control measures within each cohort of children, and non-mixing of cohorts until after 14 days. So the protocols and policies, I think, are very robust. We've done our very best to make sure that all camps open safely with good support from their local public health agencies. So I really hope that they all open safely and allow children to have a wonderful summer. I worked at a camp in Northern Ontario and did that for 6 years, loved it, and certainly am so happy to hear that children are back in the overnight camping setting. I think the systems we put in place are very robust.
Next question.
From Mike Crawley at CBC News.
Hi, Dr. Moore. Wanted you to talk a little bit about the efforts that the province is going to put forward to actually reach out and get those people who have not been vaccinated and the children who are eligible but have not had a first dose yet. So what sort of efforts are we going to see from the province in doing that outreach, and in particular, what are you going to do to enlist family doctors in that effort?
Well, thanks very much for that question. So our local public health agencies across Ontario have been working diligently on trying to get that last 10-15% of individuals who may be hesitant to come forward and get immunized and or just don't have rapid access. So that partnership has to entail great relationships with local primary care and the local pharmacists. We just recently received back the feedback from all of our local public health agencies on how they're going to achieve that last 10-15% of immunization. So it's multimodal. Some of it will be walk-in clinics. Some of it will be setting up those clinics outside of a day camp or outside of a setting where they've had a high risk of COVID-19 and working with all members of a community. So I've really been quite impressed by the multimodal methods that they're going to be using, including partnering with primary care. Primary care will be receiving lists of patients who have been immunized so that they can try to identify those that haven't and be able to reach out to those to be able to answer any questions that those individuals may have. And certainly we've been working with school boards as well to communicate back to families the need to be immunized to have the best and safest fall return of school. So I was very impressed with the plans that all of our local public health agencies have had and the partnerships with primary care that are building going into the fall to have the highest protection for all Ontarians that we can achieve.
Follow up.
On a separate topic, just wanted to ask you about outbreaks in long-term care. There have been 3 people that have died recently in these outbreaks, 2 of them in Waterloo Region and 1 in Burlington. How concerning are these outbreaks to you in long-term care, given that vast bulk of people in long-term care ought to be vaccinated or are vaccinated, and what needs to be done to bring these under control?
Well, thanks for that question, and sorry to hear of the deaths in those settings. We've achieved a lot by having prioritized our long-term care patients and workers and families early on in this epidemic and have been able to decrease the death rate significantly. But sadly, no vaccine is 100% proof, and most in the face of Delta are around 90, 92, 94% protective against hospitalization and the ability to decrease the risk of death. But if you're frail and you're vulnerable you may have still a risk of dying from this virus, even with 2 doses. So it tells us all that when we improve community immunity and we put rings of protection around vulnerable populations, we can protect them and protect ourselves. So we need to continue to embrace immunization by the workers, by the families, and protect those that are the most vulnerable to this virus. That is the way forward, as well as ongoing adherence to the best practices of infection prevention and control and screening. We can never let our guard down with this virus, as it just wants to continue to spread from person to person at a very rapid pace, especially this Delta variant. What is remarkable, though, despite the deaths, is that it was limited. When you have high immunization rates in those settings, the outbreaks shouldn't be as severe and as catastrophic as what we've experienced in the first wave and second wave in Ontario. So the vaccines have a high protective rate. They are doing their job, but they're never 100%, and there will be an ongoing vulnerability, and it's every Ontarian's job to protect those that are vulnerable by getting the highest community immunity rate we can achieve.
Next question.
From Nicole Lampa at CTV News Kitchener.
Hi, Dr. Moore. Thanks for taking my question. You mentioned Waterloo, and our vaccine rates here in Waterloo region have improved. Our case counts have come down. However, we are still seeing continued outbreaks as well as elevated hospitalizations. I'm wondering if you can provide sort of a sweet spot in terms of the numbers and trends we need to see in order for Waterloo region to, go into step 2.
So that decision would be made by Waterloo Region, by the board and the Medical Officer of Health, and we're very happy to provide advice to them. I will say that they are working full out, that we're supporting them as best we can with additional nurses, additional vaccine, and they're doing the hard work that needs to get done to achieve such a high immunization rate. The current rate of illness today, we had 25 cases declared in Waterloo. It remains a very high-risk region in Ontario at 61 cases per 100,000 per week, but it's trending in the right direction. The thing is, with this virus, it is more transmissible, it is more aggressive, and it's harder to control. You just have to look around the globe that's occurring. So you're heading in the right direction in Waterloo Region, and thank you for the sacrifices you've been making, again, for all Ontarians by trying to limit the spread of this virus. I do see light at the end of this tunnel as you build one of the highest immunization rates we can achieve. Just remembering that when you get up to 80% of your population, it still takes around 10 to 14 days to have the antibodies that are circulating that will protect individuals that just newly got immunized. But I do see, with that amount of vaccine and protection in the community, that your rates will be coming down. But it'll be hard work, and just have to thank the local public health agency and all health system partners in Waterloo Region that are doing such hard work day in, day out to protect your community.
Follow up, and this will be the last question.
My follow-up has to get back to the younger population and getting them vaccinated. If they're not at a level where you'd like to see come fall, I'm wondering if you will direct the Ministry of Education, perhaps, for the students and the families who did decide to get their children vaccinated, will you allow them perhaps to, continue on with sports teams and clubs, and would you require vaccination of students if they were to join such, teams come this September?
Well, it's really, really good question. So we'll be working very closely with the Ministry of Education to have the protocols and policies for a safe reopening in the fall. I am optimistic that we can achieve, without any additional health policy, high levels of protection in high schools especially, given the age groups that are eligible right now. And we'll be working diligently with local public health agencies and the respective school boards to have the highest rates we can achieve. We'll be monitoring it to make any recommendations, whether there's immunization policies that should be put in play over the next month, but we haven't entertained that as of yet. So many Ontarians of that age group are stepping up and coming immunized that I am encouraged that we can achieve the rates we need, but we'll monitor the data very, very closely.
Thanks, everyone.